Good evening, everyone. Welcome to DTech Dialogues. Indeed, a very, very important week. We just had the World Obesity Day, and tomorrow we have the International Women's Day and whatnot. But this evening, this hour is the most important one. We have DTech Dialogues, where we are going to marry technology to clinical practice. And what better can we talk about, right? The world is advancing, and so is our clinical practice. So, this is the golden hour where we are talking about technology and its application to and how you can just improve your clinical outcomes. So, today is a very special webinar. It is about tech, but it's also about obesity and applications there. And just to give you all, just to remind you on what DTech is, first of all, thank you all for joining in. We are really very inspired when all of you join in, encourage all of us. And of course, the diverse group that always logs in, it's very, very encouraging and inspiring. So we do have experts from the field of technology and medical fields coming together and exploring the future of tech and healthcare. And just to give you a background on DTech, it's a platform created with the vision of bridging the gap between tech innovators and healthcare professionals, fostering collaborations to drive meaningful advancements in disease technology and therapeutics. One of our flagship initiatives, and I will be talking more about that after somewhere in the middle of this webinar, is DTechCon. And we are thrilled to announce that 2025 marks the fourth year of the World Congress of Diabetes Technology and Therapeutics, of course, which is not just a conference. It's one of the most sought after global events in diabetes technology, where we all converge to discuss cutting-edge innovations in AI, digital health, and therapeutics. And I will talk more about the previous three editions also, but I'm looking forward to more insights and active participation in shaping the future of technology in our country. So with that, I welcome all our experts for today. They're all waiting patiently. Let me start with Dr. B.M. Makkar, sir, please. And I will introduce him formally, but welcome, sir. We also have Dr. Mithun Bhartiya, who is one of the co-founders of DTech. We have Dr. Rucha Mehta, who has agreed. We have roped her in for today's webinar, despite her being engaged somewhere else as well this evening. And we have Dr. Anubha Srivastava, who's just gotten free from the Mahakumbh and will be talking to us about wearable apps. Without much ado, let me also welcome Dr. Banshi Sabu, sir, who's our founding president of DTech. Sir, are you there?
He may have just gone somewhere.
Okay.
So I think before we start off, I would really like to thank Purvi on behalf of the DTech team. She's doing a wonderful job and she's a great moderator. And we look forward to the editions that she's moderating always. Over back to you.
Thank you, Dr. Mithun. With that, I welcome our first speaker for the day, Dr. Rucha Mehta. Can we have a CV slide, please? She's a senior consultant endocrinologist and director of cardiometabolic department at Apollo CVHF and EDMO Clinic, Ahmedabad. She's also the chair of the Research Ethics Committee at Mulji Patel University Hospital. And with several achievements to her credit, including and she holds very important positions in the All India Association for Advancing Research in Obesity, in the RSSDI Working Committee on Obesity. She's also part of the International Consensus Guideline Writing Group for Nutrition on insulin resistance, obesity, PCOS, and whatnot. Yes, she is an expert in obesity, and today we invite her to speak to us about all the apps that can be used for obesity management. Welcome, Dr. Ruja.
Great. Thank you so much, Purvi, for that kind introduction. And thanks for having me as a part of this very important session, DTalk Dialogues. We are all looking forward to the meeting in Jaipur in May. And certainly, I think World Obesity Week is a good platform where we can share and come together to see how we can tackle this octopus in the room, as we may like to call it. So, is my screen visible?
Yes, yes. It's
Okay.
yeah.
Perfect. So the topic, as all of you can see, given to me today was the whole symposium is on how can we leverage digital technologies to tackle this very important problem of weight management. So I didn't want to write just obesity or weight loss, but rather weight management, because as you will see when I explain to you how it becomes something that we need to be working on as disease management and what are the various applications. And really, as a clinician and the people who are attending, how can you rope in your strategies and which platform should you ask your patient to select or should you select. So let's begin with just a case scenario. What happens before you start doing all of this? Let's take a 28-year-old patient. His BMI is 38 kilograms per meter square. And of course, naturally, he desires weight loss. And as is the case with a lot of our clients, he doesn't want to spend too much money. Let me just tell you, what does he do? By the time he comes to even see you, he has certainly tried every possible gimmick on his own. He has tried, maybe he's gotten a Fitbit, maybe he's got a smartwatch, and the next speaker will speak to you about wearables. He's probably already downloaded some free app, and I'm guilty of having used all my life my Fitness Pal, the free version. I still have not paid for it ever, even once in my life. So this is sort of where the user is coming from, and you need to start thinking in those terms. He's probably heard about intermittent fasting on the internet or on Instagram, and he's tried that as well. So by the time he actually signs up for a program and pays for it, you can be sure he has ruined his metabolism completely by doing this yo yo dieting, weight loss, weight regain. And hence, I like to call it we need a good weight management program because what we are trying to induce is a behavior change. And can you use apps and technology to do this better, where you and I, as clinicians, may fail because we like to meet with our clients on a daily basis. So this was sort of the background, and we'll talk about apps. I won't talk much about AI because we have a session on that. And then what has been our experience at Edmo Clinic, wherein we have developed an online platform since COVID. So, with some trivia just to begin with, the global fitness tracker market, as you can see over here, has been increasing, and the market size, which was valued at 443.5 billion in 2022, is growing at a rate of 16.5% and is projected to keep on increasing till the year 2032. The worldwide fitness tracker market size is also expected to grow just as exponentially, and Asia Pacific is expected to have a very high growth rates and is a very exciting market for the people. Similarly, the global weight loss app market size and scope, as you can also see, from 2021 to 2031 is going to be increasing. And this is exciting. This is where we all need to be looking at. So, how does technology help you to make modern fitness journeys or weight management easier? You have many things you can do with it. For example, calorie counting, exercise tracking, making diet plans and providing them to your patients, seeing what the patients are eating, what we like to say a visual food diary, intermittent fasting timers, live coaching, telehealth component, all of this can be done with fitness modern technology. Now, as we get more and more evolved, we need to understand how is this working. So it's not simply that you can get away with having an app on a phone. There are multiple layers involved in this. So not that only do you have to have artificial intelligence involved, but this taps into machine learning and deep machine learning, which enables our smartphones and apps that are very often linked to either e-health records or to a wearable sensor and device, which then plugs them into somebody who's monitoring them or to other online communities and social media. And of course, we must not forget telemedicine, which we've all been using since COVID. So even though we are all giving separate talks, let me bear in mind that you will hear a lot of overlap and that how each of these technologies also needs to be connected to the other one very often. Now, if you were to look at AI and its subcomponents, as I was mentioning to you, that there is an umbrella group of techniques. Machine learning is a subset of AI that will then use statistical methods to enable the machine to improve the performance. And when we get deeper and deeper into this, why am I just touching upon this? That the apps use a similar algorithm. Because we are not simply trying to give them a diet or trying to get them to lose weight. We are also trying to see that how much from the diet plan is the patient able to follow or the client able to follow. Because then the app itself needs to modify what it needs to tell them to do the next day. For example, I use a Garmin watch for running, and based on my performance today, it immediately gives me my plan for the next day, saying, okay, you ran 30 minutes at 8 minutes per kilometer. Well, you didn't do so well. Tomorrow, you're going to run even slower or even faster. Or it might just ask me, how did you feel at the end of the run? So there is a constant communication. And therefore, this is also an important part of an application. And the reason for this is that whenever clients are trying to choose the best weight loss app or the best program, we need personalized treatment. We need a virtual health assistant, advanced measures, predictive analysis. All of this needs to go into play. And also, last but not the least, we need monitoring of these behavioral changes to plan what happens next. And let me just tell you, we are still going to fail sometimes in despite of all of this. So, how to choose the best weight loss app for your client? When you talk to clients, they will first say, what is the goal? Are they trying to get fitter, build muscle, lose weight, just get a good health plan? Then, of course, the market is very, very price conscious. And then, of course, they have to also look into, do they want just a diet? Do they want exercise? Or is your platform going to provide both? And it will greatly matter what have they tried already, meaning what was the user experience before, because that will determine their next steps. So, mobile apps for weight management, as I was telling you, what is going to be your effectiveness of mobile health and weight management will depend on all of these factors. So, what is the cost? The social engagement your application is able to provide. What are the features? Does it give simply information? Versus, can it also guide a behavior change? And I believe behavior change is going to be the game changer when we are trying to get our patients to lose weight. And the most important part of this is going to be daily communication with diet and activity tracking, with reminders, feedback in real time. Now, some of the external factors that go in over here is the usability and social validity. Are healthcare professionals comfortable using this? What is the acceptability and perceived benefit? And lastly, as I said, what is the motivation of your client and how much will they adhere to the same? So there are several online models for lifestyle management that exist. You all have heard of Noom, Healthify Me, Cult Fit. I just mentioned my Fitness Pal. Which one should you use? So here's a good review comparing, as I mentioned to you, all of the features we are looking at. So calorie counting, exercise tracking, is there a visual food diary? Is there an intermittent fasting timer? And last, telehealth consulting with experts, which is becoming a new thing that a lot of clients like to have because we can also guide them in an expert driven pattern and the price per month or the price per year what you're going to give them. So if you will see that most of these applications provide you calorie counting and exercise tracking. Not all of them have a visual food diary, intermittent fasting tracker, live coaching. So these are some of the older apps. We have some new apps on the market now, which I'll also try to show you briefly. I'm not going to be able to cover all the applications, of course, in the interest of time. But as you can look at the price conscious market, my Fitness Pal free version is probably very popular. You have Noom, which is about $70 per month. If you were to compare that to something else, it is zero, it's only $10 per month. So it depends on what features you're getting, how much you're willing to spend, and how much is your, determination to lose weight or what is the patient desiring. As I mentioned, in spite of all this, there are major challenges in app-delivered program because all of this finally boils down to, are you able to customize the program? Is your client liking the program and is he able to adhere towards it? What we have found through studies that this level of personalization is still insufficient to sustain the weight loss because we are unable to cause behavior change. And the conclusion was that maybe some form of emotional support is required. Maybe they need to connect to somebody in the application. Just a chat message is not enough to change behavior. One of the biggest challenges in the management of obesity, as we know, is the prevention of weight regain after successful weight loss. And this is another area wherein we have seen increasing use of AI and applications. The use of AI based conversational chatbots, hence, may have the emotional angle for weight loss. This is a scoping review wherein they looked at using one of these chatbots for both exercise, diet, stress management, and obesity self assessment, and they found good results. Now, there's also another review that talks about how we can go about doing this. And it's a very complex system which needs to build a predictive model, model training, and validate accuracy of prediction. So, moving along, we can just look at some of the apps that then came out, which is known as the digital twin. The human digital twin framework personalizes, and this was done more for type 2 diabetes management, but also has now been created for weight management. So, twin is a personalized decision support system, and it helps to manage on a daily basis diet, exercise, nutrition, and may even predict sleep patterns and what will happen if you eat certain amount of food, and classifies foods into red, green, yellow, orange. So it's a very complex network and does a very good job of kind of cloning what you might be like. And this is one of the applications that has been voted as the number one so far. We have certain other virtual AI chatbots. One of our own colleagues, Dr. Amit Kumar Dey, is developing an AI chatbot called as Madhu. Diabetes lifestyle coaching apps are now using AI. Just in time adaptive interventions, known as JITAI, they refer to the use of technology to deliver interventions precisely when individuals need them the most. So, this is the emotional angle that I was talking about. January AI, this is another application that is sort of working to tell you about what is going on in time as to what can you do. Swap the Pepperidge Farm whole wheat toast to try and lower your blood sugar by 10 milligrams. So it can tell you in real time if you snap a picture and send it as to what you're supposed to be eating. So this is something that our clients might need, and this is the thought process we have to keep in mind. Okay, so it can predict the impact of food on an individual's blood sugar. It does require you to wear a CGM. Like I said, you cannot get away from wearables and applications. One doesn't seem to work without the other. And hence, calling it a complete platform makes more sense. It is designed to provide users with information such as estimates, predictions, and key insights. Users also receive insights that should you increase your fiber consumption, calorie recommendations, and so on. So this is something that Dr. Anubha will be covering. So I'll kind of just move right along and talk about our experience. So the question that we began to ask is, since we have a huge weight loss, weight management practice, that how can we do a better job in helping our patients to lose weight as well as prevent regain, monitor their diabetes. And we decided after COVID to look at our data sets, pre-COVID, post-COVID, and a hybrid model. Is this possible? Is the weight loss durable, and how can we predict what we'll be doing in the future? Is it simply a machine learning or a user experience? Our vision was, say, to reduce, we had a very holistic vision to reduce the rate of obesity in India by 50%. If we want to scale up, we have to use a technology-based model and try to have doctors, dietitians, physiotherapists, all of them on the same platform. So we decided to go from EDMO, which is expert driven, but can be expensive if you're trying to see the patient each time. You don't have enough time to see so many clients. And hence, if we can use technology, you can take this model and reach out to more patients and make it more scalable as well. And when you compare it to other things such as, you have heard about Luke Coutinho's You Care lifestyle, you've heard of Healthify Me. Can we do a better job because we are an expert driven model? So what we did is we tried to integrate all specialists, dietitians, pharmacy, health coach on one platform. So let me just tell you, when you're developing an app, these are some of the things you might start thinking about. What are the other platforms that are existing? Online labs and pharmacy that you need to integrate because your patients want everything on one platform. Is it linked to something that can give them their electronic prescription as well? So such as HealthPlix or DocOn. Are there other telemedicine platforms that can be similar to your platform? How will you get it out to them? So this is what you need to worry about. If the customer is driven, he's going to find you. But it's very important that all of these things need to be available to them in a very easy fashion so that they can use your application. So this is what we sort of did is we have a website, we have an app, we have doctors, dietitians, and all kinds of fitness experts, psychologists, e-shop, pharmacy on one platform. And we created a mobile health platform for our clients. We also employed the use of something simple as WhatsApp and an AI chatbot with Dr. Amit Kumar Dey's help to see what happens. So we looked at about close to 323 patients. The mean age was about 41 years, about 156 male and 167 female, 33% diabetics at baseline. In the intensive weight loss phase, the patients were placed on a low calorie diet, high protein and low carbohydrate, moderate to low carbohydrate to target a weight loss of 8 to 10%. Medications were added if they failed to achieve weight loss or the diabetes was uncontrolled. In phase two, in the maintenance phase, they were then placed on an isocaloric high protein diet. Exercise was continued, and some of them were randomized to receive the mobile health intervention for daily chat support. Now, in our program, also, instead of simply a chat support, they have weekly video consultations with our dietitians to put in that emotional angle I was talking about. If sugars were not controlled, medications were added or increased or adjusted as needed at the discretion of the doctor. So let me first show you the weight loss outcomes. So as you can see, weight loss in 12 weeks in all the three groups. So the control group is the one that was coming to clinic. The online group is the patients who lived out of town and were purely only reaching out to us on the online model. And the hybrid group is clients who were living a little bit far away who would come in once a month, but the remaining visits were conducted on the phone or through video consultation. As you can see across the board, there was statistically significant weight loss at the end of 3 months. There was also an improvement in HbA1c in all the three groups, which was significant from baseline to 3 months. Now, weight loss achieved in all overall was about 8.8%. We had about 302 completers. After this, we then started to look at the three groups in this fashion. We divided the diabetics, N was 88. Then the standard follow-up group, wherein they received a maintenance diet and some exercise guidance. They were advised to follow up with us monthly or simply send in their weight, or they would get a weekly WhatsApp message. In the AI chatbot group, they had a maintenance diet exercise, but daily chatbot assisted weight maintenance tips were sent. The chatbot will talk to them. And what we monitored was change in weight, HbA1c, and the user experience. As you can see, comparing the standard group who only received text messages or they were asked to be self-motivated to come into us for weight checkups, the weight went down actually quite significantly till 9 months. But as you can see at the end of this, the weight starts to go up in the last 3 years. And there was some weight regain at the end of 1 year, almost to the tune of 25%. However, in the AI group, the weight loss, which is a chatbot group, the weight loss continued and it even at the end of 1 year. So we were able to prove that using technology did help us. Weight loss was equivalent in the online group was just as good as the people who came to clinic. Yes, it is possible. We have showed you that at the end of 1 year it's durable and how we were able to induce a behavior change using technology and enhancing the user experience. I'm not an expert at technology, so of course I'm more than happy to hear from other experts in this. But there are several things in the pipeline. These are the top 100 digital health and AI companies to watch out for in 2024-25. And I guess the way ahead for would be voice activations, gamification, validation, and more customization. So I thank you all. And since it's Women's Day tomorrow, I wanted to end with this little picture from our clinic. A little goes a long way. Let's just take that first step today. And thank you so much. I'll stop sharing right here.
Fantastic. Thank you so much for that overview. I think you did mention you're not an expert in tech, but I don't think after that presentation, I would agree with that at all. So thank you very much again. Really fantastic overview. I think what we need to do is probably get into a little more hands-on training as well. So we will bug you in the future where you can show us, the next step. You introduce this to us, and we will bug you as to how exactly we go about using it. So yes, very interesting.
Certainly.
And please wait back for questions. But before that, we'll move on to the next talk in our webinar today. Again, a very interesting topic. And I can't wait to hear Dr. Anubha Srivastav, rolling up her sleeves and going about wearable apps for fitness as well as for weight loss. And it gives me great pleasure to introduce her. Dr. Anubha Srivastav is a senior physician and professor of medicine at the MLN Medical College, Prayagraj. And she's literally ruling the department and doing lots of work with her fellows. And they just finished the Mahakumbh project as well. So we are really proud of her. And besides being well published, she's also, she's a recipient of several awards. She's also she's the joint secretary for Diabetes Education Foundation. She's the IMA National President's Appreciation Award winner. She's had several, moments of appreciation towards her, and absolutely everything is well deserved. So, without much ado, may I welcome her? And she's a very active member of the RSSDI UP chapter as well, and the ACP association as well.
Thank
So,
you, ma'am,
welcome, Dr. Anu.
for your kind introduction. I'll just start sharing my slides. I should like on this platform, I would like to thank, I think I'm able to share my slides. The DTech Dialogues for keeping it in this obesity week. And what better topic to be allotted is this wearable devices. And Makka sir being here, I'll just mention something. Once sir and I was sitting at the airport and sir told me that you should attend DTech meetings. And I think thanks to Purvi ma'am for roping me in, and I am highly obliged. So without taking much time, I'll be discussing about the wearable devices in fitness and weight loss. So obesity, I think I should first congratulate Dr. Ruchita for a wonderful presentation and what inspiring work she is doing in the field of obesity. Talking about the wearables, yes, the burden is huge, and hence they can help us address these challenges through the scalable intervention. She, in her own data, showed us how that can be changed. This is the burden, the NFHS data. There is no rural-urban divide. There is, if we see, the childhood obesity is on the rise, and it is a root cause of all the disorders which we now see. So talking about the wearable devices, they are small electronic devices which basically have sensors and have computational capabilities. And they play an important healthcare monitoring, analyzing, and as we've seen, the behavioral changes which can be brought about. So the AI is there in all these sectors. If we see focus on the healthcare sector, it is going to change the perception we have and the way we treat the disease, especially the metabolic diseases. If we talk about the types of the wearable devices, the most common everyone is using the watches, the Garmin, she told, Apple, Fitbit. For tracking our activities, for monitoring heart rate, for sleep, we are using it. Fitness trackers, the bands, the biosensors, the CGM machines, they are being used extensively. The smart clothings are available. They can monitor the heart rate, breathing, and the activity. The implantable devices, the Eversense CGM, they can also be very helpful. Hybrid device, yeah, the Aura rings are available, and they can assess the metabolic tracking could be done. So we have the devices hand worn, head worn, body worn, and the principle being the sensory media through which we are able to detect their activities or track their activities. So we have seen the smartwatches. I'll be discussing more about the data regarding it. So the calculation of the step counts, the calorie counting, and yes, they are important point in maintaining or adhering to the goal and the weight loss program. The fitness trackers, they do have their same focus on step count, distance travel, and calorie expenditure. So not only the weight loss is there. They may help in behavior modification. This is a real-time feedback. The goal setting is possible. So they are important in producing participation of an individual with their doctors. If you motivate them, if you allow them to participate in your weight loss program, they basically, these devices, they can sense the body movements, they can monitor the heart rate, they can actually sense the sweat, and so the technologies, they can detect and monitor the cardiovascular activities, and they can be linked to the phones, and hence they can indicate the overall physical activity and energy output. So these are the commonly available devices we have. The CGM, which we use in the diabetes management, can also be a milestone in assessment of postprandial hyperglycemia. I think the Facebook also is having one. Rohan, he's have taken this shiitake noodles. See how much my blood glucose raised after taking this, or comparing to chocos to the muesli. So now these are important devices which actually can assess the postprandial glucose response and personalized nutrition. One banana, how much the blood glucose spike can be seen. The smart clothing here, without any additional devices, the continuous monitoring can be done. They have role in tracking physical activity and an expenditure. So there's one study which showed Hexoskin users achieve 7% weight loss in 6 month study. So, but the cost is a concern, and they are a future now. The implantable devices we were talking about ever since CGM, they're long-term glucose monitoring without frequent sensor changing, and they have shown a very good HbA1c reduction over 6 months. So these are about the available devices, and this is one of the case report which has shown a significant reduction when in a 12-week CGM guided intervention was done in an obese diabetic patient. The Aura ring, this is now one of the popular rings which can combine the metabolic tracking and the sleep activity, and they have a role in obesity management. And you can see this is one of the data of the this ring, and it is highly effective and is nowadays in quite a demand. So the principles of wearable devices in the obesity management is the activity taken. This not only motivates, today I have walked this much step, or I have to cover this. You make a goal, which is achievable goal. You complete that goal. You can actually know the distance walked or run, the calories burned, and the minutes you have taken. Even the watches can tell about the anaerobic exercises, the fat loss exercises which you did. So this is a real-time feedback you are able to achieve. The sleep duration, sleep patterns can be seen, and hence the importance of sleep for the weight loss is there. The heart rate monitoring, the calories expenditure, a personalized workout adjustment. I think Dr. Ruchita was talking about the AI. So these all devices are an important tool for prescribing a customized prescription to the patient, whether it is the nutrition tracking or the physical activity tracking. The food scanner features are there. They can actually log on to their apps. She told about the the Healthy Find Me app, MyFitnessPal, they're one of the popular apps, and they are quite effective. So the wearable devices provide real-time data, which is crucial for designing a personalized exercise program. So the goal setting, the feedbacks, they can connect to other social subgroups, and that can be helpful. So the benefits are the motivation, the data visualization, the feedback, the personalized approach, and hence the behavioral changes, the conscious decision making regarding the food choices and activity levels, and improved self-efficacy. So, but then it also comes with the challenges in wearable technology. The sensors may have variability with different devices we have. So they may have a variability in sensor performance and data interpretation. Privacy and user compliance will always be an issue for the data security, consistent usage, and data input. So barriers to adoption can be from cost to usability to patient engagement. Ethical consideration, we don't have any legislation for the data privacy and security. The regulatory challenges are there, but there's definitely the future for improving better sensory accuracy and ethical concerns. So this can be overcome. As she told, there is significant change after a year. There's an education and training can definitely be helpful. The customization needs to be, and privacy concerns have to be explained and educated to the patient. Now we have advanced sensors and biomarkers, which can actually, this is in the Nature Biotechnology, which was published about the monitoring of the lactate, ketones, cortisol, and blood pressure, and they can be an important tool in obese patients. Some of the data which I was able to collect. So Dr. Ruchita has shown an excellent in-house data. Let's talk about what are there are some pros and cons. So this is one of the review literature which was published in Curious, which talked about the digital technologies having been extensively used for weight management. So this was one of the study which was published in April 2021. They have shown that these technologies facilitate self-monitoring, goal setting, and personalized feedback, helping to reduce significant weight. There's another smarter randomized trial. This also have shown that the patients who were motivated and who had self-monitoring plus this feedback had a better and a significant weight loss. Another study which was done with the wearable devices, they also have shown the similar results. This was one of the study done on 58 older age population. They have shown that this was a feasibility study, the feasibility of integrating a wearable fitness device to track physical activity and high-touch individualized multi-component obesity intervention, and also shown good effect, especially in we have seen in the obese elderlies, also in the children and adolescents. So we have some regarding the technology. So now we have lots of publications about the physical activity and whether it works. But yes, the e-health intervention promotes physical activities. As my previous speaker talked about, when we talk about the standard way of treating the patient, there's a major issue of regain. Same things, one of this big study with where a long-term weight management was seen with this. So this issue, which a major issue, is the challenge of separating the effect of decreasing use of wearable devices over time from the effect. So there was a gradual decline from the time of use. This is one of the project which was taken by World Obesity Federation, which was published in JAMA. This was known as Daphne trial. It was a pilot study to show the feasibility, and the result are only speculative. But here they have clearly mentioned that there is not much of patient empowerment, but patient's participation. Patient using the sensors on their own may not be motivated so much as the patient feeling that they're working with their clinicians. So this is a massive step towards it. It's a long way to go to where we can say they are effective, but we need more motivation. AI definitely can be helpful for the continuation of maintenance of weight loss. In the Lancet, they have published that the NHS in their long-term plan have to introduce the digital intervention to support adherence to healthy diet and exercise. And we hope for more regulations and legislation in this manner. So wearable health devices stand at the forefront of modern chronic disease management, especially in diabetes and obesity. It's a real-time monitoring and enhancing the patient outcomes. This shift encourages treatment compliance and patient involvement. So the more approach is needed in the public sectors, and we need Advances in AI and machine learning may be helpful, and integrating this with the EHRs may also be required. Challenges, though they are there, but the future seems bright and they can transform obesity and diabetes care in our clinical practice. These are some of the devices which are available: the Samsung phone, the Apple phone, your watches, the Fitbits. And these are the data which can be actually be gathered once you're walking, you did a yoga, you did what is your sleep patterns, which can be seen. This is a Garmin watch. This is one of my friends, and this is a 1 month data. If you can see that the total count, the total steps, the BMI, the weight loss, and the total death. So how much effect can be seen, visually can be seen over a month's time, which is so much impressive for the patient. So empowering patient and clinicians through the wearable data is the need of the hour. So I should say we are what we repeatedly do. Excellence, therefore, is not an act but a habit. So transformation will definitely happen, but we have been using it, and we just need to break our own barriers. Thank you, and a very happy Women's Day to everyone there. Thank you.
Thank you so much, Dr. Anubha. I think that was the perfect talk following Dr. Rucha's opening talk on the apps. You followed it really well with the wearable apps, wearable devices. And I think that's just taking one more step forward in leveraging technology for obesity and fitness.
Yeah.
So thank you so much for that very comprehensive overview.
Thank you. Thank you.
And viewers, I hope you are, taking good notes on what we are learning today. Without much ado, let me just dive into the DTech Con. Just an overview and the advantages you are, privy to if you register or have already registered.
Yeah, we have registered. I have become an ambassador of DTech conference.
Excellent. We are so happy that you are the ambassador, and that community is just growing. And a lot of other features are available for the DTech Con Pro users, the ambassadors, to be able to, take advantage of. And it's only growing every day. So let me just share that with you all. And bear with me for a few minutes. This is between me and between you and Dr. Makkar sir. So, but let me just give you this overview quickly. As we know, diabetes technology has taken a massive foot forward, and yet, this is globally. And yet we have just two major conferences actually covering every other conference on diabetes. Every week there is a conference, at least in India, and then major conferences in the world do cover diabetes technology to a certain extent, but it's the ATTD, or the Advanced Technologies and Treatments for Diabetes in Europe, and then the DTS, or the Diabetes Technologies Society North America, that have their annual conferences and share more insights on innovation and leveraging technology for diabetes care. With this, there was a gap, and there was a certain need felt that we must, as an emerging economy, as well as having, say, the highest number of diabetes people in the world, definitely we needed to focus on diabetes technology as well and the adoption of it. And with that was founded DTech. And I already introduced to you that, why was DTech founded and what it really aims to do. The first conference of DTech Con was, and that is, it was founded by Dr. Banshi Sabu sir, along with the other founders, and I've already shared their names with you all, and I'll go through that further. The first conference of DTech, or the DTech Con itself, was in May 2022, the World Congress of Diabetes Technology for the first time. And that was an online meeting, just sharing one of the snapshots from it. Dr. Jyoti Dev sir, Dr. Manoj Chawla, you can see Dr. Rakesh Parekh, all of them are co-founders. They are honoring Dr. Thomas Dani here, who's a big name in diabetes technology. The third one was last year in Kochi, again, very well received. In fact, there was so much of euphoria around DTechCon that at the end of it, within a week itself, we had more than 150 registrations for this year. And this year, it's yet to happen in the month of May, but 9th to 11th May 2025 in the city of Jaipur. It's being hosted. And we are really very excited. This is the committee, organizing committee with the patrons, advisors, and the entire committee who's planning the DTech meeting at Jaipur, which all of us just get to enjoy and not work for. So the World Congress of Diabetes Technology and Therapeutics 2025 is here. And this is what you will see on the website as you do submit your abstracts so the committee can decide. And this is closing on 15th of March. So we still have a few days left. Don't miss that. And then again, you can also apply for a travel grant. The organizing committee will review all the applications and the selected applicants will be notified via email. So definitely take this. If you have registered, you can submit for a travel grant as well. So don't miss out on this opportunity. The next thing to leverage on is the IJDT Editor's Choice DTech Yearbook. Again, this I thought is a really fantastic opportunity. Any article of your choice in the field of diabetes technology that has been published post 1st January 2024, which means in the last 14 months or so. Make a summary of it or an excerpt and with all the key highlights, and you can submit that as your application. Again, the committee will review it. If they like what you have written or summarized from that article of your own choice, then you get to present it in the IJDT Editor's Choice. And if you miss out on that, there's also a very good opportunity that it will be published in the DTech Yearbook. So again, friends, don't miss out on that. And this is closing on 31st March. So the year end is still bringing you a lot of gifts. So do take advantage of that. Again, this is another very golden opportunity. There are 4 landmark papers coming out from DTech. One is the expert opinion on use of artificial intelligence tools, the DTech guidelines for management of type 1 in India. There's a DTech consensus on use of CGM in type 2 diabetes, and then a DTech position statement on the use of mHealth apps in weight loss and reversal of diabetes. Well, leave it to me. I'd want to be part of everything. So do, given your applications, choose the paper that you would like to be a part of. This is open only to those who have registered for DTechCon. So it's open now. Don't miss out. This is a fantastic opportunity to be a part of these publications. And this will be in the official journal of DTech, which is the IJDT. Again, as part of DTechCon, there's going to be a certificate course on the insulin pump school, hands-on workshop, and also the CGM Academy. I think these are so valuable. I have attended these myself in the ATTD, and I can tell you that these are game-changing for your clinical practice. So registrations will be opening soon. Grab that as soon as they are open. Do watch out the space. You've got to be a part of the WhatsApp group, the WhatsApp channel, so that you don't miss out on the queues on when the registrations open. And this is the entire milieu of DTech, or the ecosystem, as they would like to call it. The industry people, of course, all of us medical doctors, the end users, or the people living with diabetes, obesity, and other health problems will also be there as part of the conference, and importantly, investors and innovators as well. So this is what DTechCon plans to do, and it has already succeeded in the first three conferences as well. And soon we will be announcing about the AI live workshop, the DIY artificial pancreas hands-on workshop, the DTech oration, the JP Bose oration, keynote lectures, and the entire scientific program of 2.5 days in 3 parallel halls. So you still haven't missed out, but the registrations will close soon. So do grab that opportunity, go on the website and do that at the earliest. With that, we move on to the next talk. We have, and this is again a very, very interesting topic, and I think who better can do justice to this topic than Dr. Brij Makkar sir. Really excited about this one. Dr. Makkar sir is a senior diabetes and bariatric physician from the city of New Delhi. And of course, sir needs no introduction. He's such a veteran in this field. We just earlier had a webinar with him on obesity, and really it was one of the best. So I'm looking forward to today's talk as well. He's also the immediate past president of RSSDI, the current secretary
We can
of
skip
RO,
this.
and
There is no need.
ex-chairman of the RSSDI Delhi chapter. And I think he's just going to start scolding me if I read out any more. But of course, let me welcome him warmly to talk to us about AI in obesity management. The stage is all
Thank you,
yours.
Purvi. Thank you so much for, first of all, inviting me for this webinar as a speaker, though I don't think I am very kind of, grassroots learning person in technology right now. But I think this is the right time when everyone has to start learning about technologies for medical management of all chronic diseases. It's not diabetes, it is not hypertension. Everything will require technology support. And that is why when Purvi told me only 3 days back, sir, you have to do this, I was like second thoughts. And then I said, okay, I will do it. And we had two brilliant presentations from Rucha and Anuba. I think we must congratulate both of them for wonderful presentations and also setting the stage for my presentation, which I will try to do justice with. I am going to speak on transforming obesity management using AI. So I am going to share my screen. Are you able to see my screen now?
Yes, sir, it's perfect.
Yes, sir.
So thank you. So I am going to speak on AI transforming management of medical practice, management of obesity practice. And I must acknowledge, the support for making this presentation from Dr. Alok Modi, who is very active with the AI, and Dr. Atif Sheikh of Y Health, where I am also involved as in that development of this platform, which is AI-based platform for managing cardiometabolic health in clinical settings. I don't have any disclosures for this, except that I am also involved in M Health or Y Health, where I'm going to show you some of the slides, how AI can be used in management of obesity and how can it, transform obesity practice. I don't know why it is not moving. Yes. So AI is transforming obesity management in doctors' consulting rooms by offering personalized, data-driven insights into enhanced patient care. We all have been using, evaluation of obesity, the inch tapes, the digital scales now, and then the, body composition analysis using BIA. But I think these are just, tools which are supporting data generation. We are moving far ahead of these measurements, though these measurements will remain integral inputs into the system to have a better learning about the disease and better management about the disease. Now we are getting smart scales, which are not only giving precision measurements, which are integrated with AI, such as Withings Body Plus, which not only just give weight, they track trends of body composition and weight. And they give very useful inputs to the physicians in managing obesity and how the weight fluctuations or the body composition and fluctuations are happening when one is going through weight management. We have, most of the things, gadgets have been shown beautifully by Rucha and Anuba. So I'm not going into details of this, but I'm just trying to build up concept of how they are useful in, supporting AI and how they are useful in building AI for managing obesity. So a tracker like Fitbit does not only give you the scale of activity or the caloric burn, but it is giving you continuous inputs. And these inputs can be merged with the pooled data and generate insights into how the person is behaving in terms of the physical activity and how it can be improved. So data, is very important in building up AI also. Then AI can give you enhanced insight into the nutritional assessment. We have now, scan systems which can scan the food and give you the breakup of the macronutrients and even the micronutrients to the extent that you can calculate what amount of sodium and potassium is being taken in particular meal. And these, can help us building very precise nutritional advices or recommendations for any patient. Food scan is one of the components of Y Health where I said I'm involved. And what you do is you just using any phone camera, you can scan the food plate and it gives you a rough calculation of how much carb, how much protein, how much fat is there, and how many calories are there. And not only that, it can tell you that with this kind of food, based on inputs coming from glucometers and CGM, what kind of glucose response is going to be there. And based on what you had in the previous meal, it can also tell you or give suggestion that in next meal, what kind of caloric intake you should have. There are predictive health analytic tools like IBM Watson Health, which process medical records from patients and identify the patterns, and they are able to kind of predict obesity-related outcomes in future. They can predict prediabetes or other complications of diabetes with the certain degree of accuracy. Then you have AI chatbots now who are continuous support for the patient. As Rucha mentioned and even Anupa mentioned that people who are having chronic illnesses like diabetes and obesity, they need ongoing support. And these chatbots, they offer 24/7 motivational support. They also provide a lot of nudges to improve patient behavior. They are all, constantly available assistants that they also provide timely interventions. Like somebody has forgotten medication or taken an extra meal, and you can get inputs from a CGM that the glucose level has gone high. This will give you a nudge that, look, your glucose is going high, and next meal you have to be careful what you are eating and make sure you are monitoring your glucose level. It also nudges that your weight is going up by 0.5 kg over last 3 days. So be careful, you are going to gain more weight if you are not, controlling your activity or diet. So all these nudges are very important. Then continuous glucose monitoring or the real-time monitoring, even with the, AI-driven glucose meters is very helpful in providing the glucose response to a meal or a physical activity. And accordingly, you can customize the recommendation for the person who's using this in terms of improving physical activity or improving diet or changing the dietary pattern. Now you are getting, inputs from a food scan, you are getting inputs from an activity tracker, you are getting inputs from a CJM. And all these inputs are being merged and analyzed by, engine in the background and providing recommendations based on the AI. Now, this AI is built up on basis of pooled data from a lot of patients and prescriptions. And based on that, how a physician is prescribing or recommending changes in behavior or medications can be done by AI. Not only that, this pool data is also merged with the clinical practice recommendations from different societies or apex bodies, which are the guidelines for management. And based on this whole input, AI can give very decent recommendations on what to do as a next step. Similarly, we have now tools which can scan the images and tell you how the fat distribution is there in body and how precisely you should look at a particular patient in terms of the impact of fat distribution. Then AI can be very good educational tool for patients, providing immersive experience. You can use virtual reality and you can show the patient, if he is exercising, how the body is going to improve. You can also show them that if you are exercising, how this is impacting your metabolic changes at cellular level by, virtual reality videos. And this also helps in a lot of motivational enhancement. And you can also make them experience how their health is going to improve with the changes in behavior. So all these things are very important. So data analysis is one of the important keys, and we have predictive models even with Google Health, which can forecast the weight loss outcomes based on lifestyle data, refining treatment plans, and so on. Even something like Alexa can be a very important tool, which can tell you that you have, time for your medication, you have your appointment lined up tomorrow morning, or, you have not gone for a walk today, and so many things. And all these tools collectively empower both patient and doctors to provide evidence-based or individualized or hyper-personalized, obesity care recommendations. So you can also develop digital clones of the patient. So you are getting inputs from wearable devices, you are getting inputs from EHR, you can get inputs from health app data, you can get inputs from the investigations, genomic data, and social activity data. And this all goes to something called ontology. Ontology is basically, creating a concept or a model based on a pooled data, large amount of data set. And this collection and data integration and developing a model gives you a digital patient or digital twin of the patient. And you can see how this twin or how this model is affected by different components of physical activity or eating behavior, and how does it impact the glucose regulation or the metabolic health. And based on that, you can create recommendations which you can again track based on the inputs coming from different sources and see whether patient is improving based on these recommendations or not. So, this whole model actually is working on a closed loop system. You are getting more inputs, the model becomes wiser and gives better recommendations, and there is ongoing machine learning and deep machine learning, which is improving the AI response to any kind of data input. So this is a very integrated system where every data set becomes important, improving the AI recommendations and improving the patient outcomes. Not only that, we are now moving to the era of doctor clones. So we have, a patient data pool. Suppose, in this Y Health, we have created a doctor clone also. So there is a patient data pool of, say, 20,000 patients. But the important thing is we need to have data. In India, unfortunately, we don't have data. That becomes a challenge. So 20,000 patient data which encompasses the patient complaints, the clinical examination, the investigation reports, the treatment given, the follow-up, recommendations, the follow-up outcomes or changes in the investigation. All that data is pooled into a uh, machine. And based on that, and you are combining with this the rule book, you can say, or the guidelines. Based on that, you are creating recommendations for diagnosis and treatment. And based on these recommendations, again, you are following up how patient is responding. And this again data is coming back to the AI bot or the background system, where it is merged with the existing model and improves learning or maturation of the AI bot to provide even better recommendations. And so this is something very simplified version that patient can put in the presenting complaints, medical condition, some points in the history, and what is the family history. And within 16 seconds, you can get an output here, which can tell patient, look, you are having this kind of disease, and this is how you should proceed. This is something very simple, simplified version of how a doctor clone can work. And this actually gives you a output in 16 seconds. So we have so many things where data is coming. We have something called digital biometrics or Y vision, which I will show you. There is a technology now which is called transcutaneous photoplethysmography, which picks up the reflected light from the subcutaneous blood and circulating molecules in that, and it can bifurcate that light into to identify different molecules and tell you how much is the hemoglobin, how much is the A1C, and things like that. You have data coming from biovariables, you have data coming from the lab reports, and you have data coming from the digital twin. And all these get merged to provide you better insights and better outputs in terms of improving the recommendation from doctor, because doctor now knows what is the real time data coming from a patient. It improves the predictability of the outcomes. It improves patient engagement and outcomes. You can run clinical studies based on the real time data. Patient becomes more active, clinical inertia is reduced, there is better engagement with the doctor, there is better decision making at patient level, and there is better empowerment of the patient. And you can get data from all kind of connected technologies. Hyper personalized actionables will be there coming from these technology. You can actually go for precision medicine based on all these inputs coming from different sources. You can actually run a virtual obesity clinic where you are getting data from wearables, from the digital twin, from digital biomarkers, AI-powered analytics, and precision diagnosis coming from a digital clone of a doctor. And finally, you can give advice on a telemedicine or a video consultation platform, and you can run the whole clinic in a virtual format. So this is the platform, kind of feel you can have. So there is a facial scan which gives you digital biomarkers. It tells you real-time glucose based on a facial scan. You don't need to have a prick. It can tell you A1C also. It can tell you cholesterol level. It can tell you SpO2. And maybe in near future, it will be telling you the kidney function test and other things. You have food vision, where you scan the plate and you know the nutrition composition of the food. You have digital twin of the patient. You have the AI health coach, and you can create nudges based on all these inputs, which are very hyper personalized for the person who's using it. You can move on to precision medicine. You can also help create support for newer medications like GLP-1 analogs, where a lot of handholding is required during the management. And you can create customized metabolic review program or management programs. So this is how it works. You have a facial scan which in about 12 seconds, 30 seconds. Now, I think 30 seconds, it gives you the blood pressure, the breathing, respiratory rate, the heart rate variability, and so on. It can actually work on a model to give you a hypertension or diabetes risk also. Then you can pick up the glucose variability from a CGM. You can also see how the glucose response happens in response to typical food, which food causes a bigger peak, which food causes a smaller peak. And based on that, and based on the last meal, you can tell that this should be the next meal so that your glucose becomes more stable. Also, based on the couple of CGM reports and response to food, you can have a predictable CGM. So you start with a virtual CGM that based on the AI learning or deep machine learning, after 2 or 3 CGM usage, now machine can tell you that if you are having this food, your glucose is going to respond like this. So you don't need a sensor further on, and you can still keep predicting how the patient is going to respond. And you can, work out customized programs for obesity or diabetes using all these AI technologies. So now we are moving to the era where this is a report from Medscape on 7th of March. No, this is not 7th March. This was on February end, which showed that maybe you will have a bill which will make it legal for the AI to prescribe medicine also. And this is the Google today, where you are looking at, will AI be the better prescriber for better health rather than the uh, doctor himself. So we are moving to an era where AI is going to play a big role in management of all chronic diseases. With that, I conclude my presentation. I hope I have been able to do justice, and I think I finished very much within time.
Yes, very much, sir, in time. And so we were able to see that app in that Diabetes India Ahmedabad stall.
Yeah, it was there, yes.
So it was so.
Thank you again, sir, for that wonderful talk. And I think this webinar is quite enlightening, but also very humbling because it's really, like you said, we are all students of, learning new technology and specifically AI. So we are all equally brought down to our knees, sir. Don't worry about it. You're still the veteran.
No, I don't think so. I don't want to feel like veteran. Why do you want me to make me feel like a veteran? I still want to feel like a student only.
Great, great. So we will keep that conversation for an offline
Yes,
discussion.
yes.
Great. So, with that, we move on. Yes, there are apps and there are devices, and then there's AI and there are healthcare providers. But, ultimately, it's all for the person living with obesity or the person living with diabetes or just anyone who wants to invest in their fitness and in their health. So, what is it that the patients expect? And I think that's the bottom line, right? I mean, that's the last word, and that's the bottom line. We're all actually working for them. We're all wanting to make their lives better. And ultimately, whatever we develop, whatever we create is all for that one end user in the, who's the most important player in the entire milieu. So without much ado, we are very fortunate. We have one of the co-founders of DTech with us, Dr. Mithun Bhatia, who's a senior endocrinologist from Guwahati, Assam, and who's trained in the UK. And you can see the very decorated CV. I can see the pop-up on the Rising Star Diabetes UK 2013. Rising Star India 2017 has been awarded so many other uh, awards as well. And he's been recognized for his work in the field of diabetes, testosterone, and erectile dysfunction as well. He's also the president of the Association of Clinical Endocrinologists in India. So without much ado, let me hand it over to him to give us the last word on, what do patients really expect and how do we go about managing that?
So thank you, Purvi. Thank you so much. Let me just get the slides up. So is the slide visible, Purvi? And is it moving?
Yeah.
Okay. So at the outset, I would like to thank Purvi again, once again, for doing the fantastic job that she is doing for us. And she's already welcomed everybody for DTech. She's briefed everybody. I think this is a movement that we had started under the mentorship of Dr. Bansi Sabu. We all know who's an innovator thing for everything. And I think this is going leaps and bounds with every year that we have done it. And the first time that people have registered for a change, all doctors have registered at the end of one meeting with their own money. I think for India, that's a big achievement. For UK, that was a normal thing. For India, that's a huge achievement for people to register. That shows that we are doing the right thing. And with everybody's support, we shall be able to grow bigger. So I think a lot has been talked about apps, a lot has been talked about how to manage, what are the tech side of things. I'm going to talk about some soft things, soft skills that we need to actually look into, and how do we manage patients' expectations. I think it's very important to understand when we have a patient and we are going to prescribe something for this patient, whose agenda are we driving? Are we driving the patient agenda? Are we driving our own agenda? Because we have been taught in a different manner in medical college. We will talk about nephropathy, neuropathy, blah, blah, blah. Our tick boxes, hypertension, blood pressure, सब कुछ tick box हो गया. This is our agenda, our comfort zone. Or is it the patient's agenda? Is it some pharmaceuticals agenda that we are, somewhere we are pushing the pharma agenda? Or if we are asking the patient to use an app, are we using the app owner's agenda? Because at the end of the day, who's the data belongs to whom, and how much secure is the data that the patient is going to give in today's privacy world. So I think that has to be very clear in the minds of the doctor. Where are we moving with the agenda? Because once you've decided which agenda you want to move, there are gray areas in between them. That is not black and white totally. I think that gives us a ballpark figure where and how, khana mein namak hai, namak mein khana hai, to decide which way we are going to move forward. The second thing which I found it very easier to understand, or important for me to understand, is the W's and the H when the patient comes to see. Why now? What happened that you have come to seek my advice for weight management today? Why not 3 months ago? Why not 6 months ago? Why not 1 year ago? Why today you woke up one fine day and said, Aaj to kuch karna hai? What has happened? What has been that trigger? And that trigger is extremely important, because that trigger is your nerve line when something goes wrong. That trigger is your nerve line when something goes wrong, because that is the trigger that is the most motivating for that patient. And that's the trigger you really need to have your hands upon, to actually have a plan as to why this has happened and what can be done in the forward. Obviously, more history has to be taken, as how did this weight can happen? When did it start? Who has sent you to me? Is it your partner? Is it a family friend? Is it you have seen somebody on inspiration on social media? You've seen Karan Johar. You've seen somebody else. The news by Musk, that he's using this, he's using that. What is that motivator factor? Because that is his ideas, and from his ideas will come his concerns, and from his concern is going to come his expectation. I think till we can trace this movement, the movement is going to be very different. Now, as doctors, we are generally, diet is not something that is taught in medical school, which is very unfortunate. And I hope that changes in the future. And I think I've been told that in some, nowadays, new degree has come with diabetes and metabolism. I've been told that has been started, but that's a welcome thing. But traditionally, diet has never been taught. And it's important that we update ourselves and learn the basics, because people are going to ask us questions. And in today's world, you can't make fool of patients. Everything is there. All the apps are there. On the Google is there. AI is there. They're going to find out. So I think most importantly, as frustrating as it sounds, as realistic as it sounds, I was taught in England to say something is I don't know. And I think the more the truthful you are with your patient, the better you can match his expectations, and you can say we can tread on this together and find a clear way. Now, the other factor which you need to match with your patient is what does he want from you? How much time he wants from you? How much messages he's going to give you on WhatsApp, and what time frame is he expecting you to answer these questions? How frequently are going to be frantic calls of desperations and frustrations when he's going to go on some modification of his usual life? Because I feel in India it is more easier, it's a very difficult statement or more diplomatic statement or non-diplomatic statement. I think it's very difficult to change one's lifestyle. If you've never eaten oats in your morning breakfast, tomorrow you want to wake up and change everything, it's not going to happen. So you're going to tread on it together with the patient. And importantly is to understand his expectation is, what is his expectation? Is it a smart expectation? So by smart, we mean specific, measurable, achievable, relevant, and in a time frame. So if you're going to say, look, I'm going to aim for a 3 kilogram weight reduction over 3 months of time with a weight loss of, with a, waist, waist going down by this much, and this is specific, it's measurable, then that is a goal. Vagueness, I want to get thinner, I want to get this and that. You need to have specific, clear targets and a time frame that we have to follow. Makar just talked about future AI may do prescribing. I think it's very important at this point of time. We also need to know what are the legal implications. When you're going to recommend an app to the patient, they're going to do something in the future. Who's going to walk the cake if something goes wrong? Is it the doctor? Is it the patient? And that is what I worry about many apps that are there, because the onus lies with you. So I think overall, it is very important to have a shared goal with the patient. This is what I mean. A shared goal means together, let's form a plan of action. We are in it together. You are not alone. It is not mine. It is not yours. It is ours to get you better. And have a safety netting as to clarity as to what you are expecting from him. And it is nicer if he writes on a piece of paper, this is what I am going to do. And I find that I find that very useful. When the patient puts in pen in front of me on a piece of paper, the commitment is also showing a little more when he's committing right there. We know on a chronic condition like weight loss and diabetes, sometimes a lot of life events happens and the goals are not achieved. So re-goal setting is always, important. So reassessing of the situation and re-exercising the whole thing is important. But I think overall, realistic, as I said, smart goals and a togetherness with the patient and a clarity whether you can give, that clarity has to be done. Rucha talked about she has got a plan, she charges this much, or this might happen. Fantastic. So I think the buy-in and the clarity of the financial deal with the patient is very important. You don't want to get frustrated. Patient does not want to get frustrated. The sooner it is all laid out in black and white right up the front will lead to a better goal outcomes of the patient. With that, I thank once again, Purvi. We close to 9, so I thought I'll stop here and take any questions. Thank you.
Wow, I think you have certainly discussed managing patient expectations, but you also, managed our expectations as well. Thank you so much, Dr. Mithun, for that wonderful, deliberation on managing patient expectations. I think, we can talk about it for hours together because with all the myriad of experiences that healthcare providers have. So, let me just step on to questions. And my first question is for Dr. Anubha. This is from one of our audience logged in today. And thank you for the question. The aura rings that you talked about, do they have any solid evidence, or are they, because they're developed by independent researchers? So is it more like a marketing gimmick or something fancy, or do they have solid evidence along with?
I think thanks for the question. It's a very apt question. Yes, it's like everywhere, everyone is having this ring. So this is a new in thing. And just getting and searching the literature, it has shown the its a specificity is around 73 to 75%, when more specific for the heart rate variability, which is very good specific. And this data, as I was searching, when I found that the limited literature is there. There are certain Japanese study which has been done basically on the sleeps. They have compared with the polysomnography, the ring, the data which was assessed from the ring, and it was compared with the standard polysomnography, which showed that they have a very good response similar to the standard of care results. And there was some data with the heart rate variability, which was compared with the electrocardiogram. But specifically on obesity and weight loss, we don't have much data where it is compared to the standard of care. So we still are in look for the data. But as I said, as Dr. Mithun very well talked about patients' expectations. So this may be, we should say that this is basically for the patient participation, patient motivation, where the steps counts can be very accurate, your sleep cycles can be tracked about, so the heart rate variability can be picked up. They can be a pillar in the management, but they definitely they will not be. They can be a tool for our weight loss journey. But still, more data, more literature, and needed to label it as a scientific evidence in the weight loss management.
Great. Thank you. Thank you so much. I think because this is relevant to Rucha's practice also. Rucha, do you think that, what do you say when you are not, do you encourage your patients to use apps and wearable devices, even, the free ones or even the paid ones? And even because we know that it's actually not all that easy to generate evidence with all, and sometimes the technology is so new, like Dr. Anubha also said that yes, we would want more evidence, but uh, and evidence will get generated as people start using it more. What is your take on that? Like, should we just go ahead and tell our patients to use it, or are there some quick gaps?
Absolutely. I don't think that any one of us can stay away from technology. I think Dr. Makar also alluded to that. And I'm sure all of us will agree that if we don't get on board, we'll be left behind. So certainly, in fact, when we start teaching our clients, or when we did not have our own platform and we were teaching them calorie tracking, we were asking them to download free versions of several apps which are friendly to Indian diets, Indian menus. We have been doing that and we have been encouraging it. And yes, I mean, for everything in life, we don't always need to see the data. So we are trying to see data for large volume behavior change. But in our own practices, we can certainly monitor from patient to patient and get feedback and see how things are going. So I think for example, we have an electronic medical record, which we have worked with the person who made it to integrate, wherein we have video consultation, we have chat function, we can upload diet plans, we can upload exercise allergies, food likes in the tag. The patient can also see that we are aware of all of this on their end. So I think, and as we tell them more and more, they're all been downloading that application and working on that. So I think we have to, yes, we do encourage them for sure. Yes.
So there's one more tag along question. The weight loss programs. Do you think the huge cost that the patients pay for the program itself, along with all the wearables and the other applications, do you think that has a role, as a motivator for them? Because of course, if they don't comply, then definitely they're going to lose out on the money also.
Yeah. So yes, in this, this is where, of course, the AI will come into play to make it cheaper. Number one is, how do we make technology accessible to everyone? So that needs to be the goal of everyone, all of us, since we are a national DTech body. We are not trying to make healthcare inaccessible. The whole mission of this DTech committee, I would understand or believe, is that we make accessible diabetes care, nutrition care, weight management care available. And I think we all need to get together and figure out how we can provide something that is, I don't want to say cheap, but affordable, something that is safe and scientific, that is, based on all these experts in the room, not just for. So we are the health solution provider, and we need somebody with a technology expertise also working alongside with us, so that we can integrate artificial intelligence, machine learning. As Dr. Makkar said, the Y program is also now cloning doctors, so we can have more and more one-on-one integration, and therefore have accessible healthcare for all our patients, and which is available, not too expensive, so that they can avail of it on an ongoing basis. Because it's not something you do for 3 months, 6 months. As we all know, the minute you stop doing it, it all fails or falls apart.
But do you think the money itself is the motivator? Because, they do end up spending a lot.
Yes. So, that it is a double-edged sword, Purvi. So there are studies done on this actually. I wish I would have shown that data, that anything that is free is not appreciated, as we like to say. Again, there has to be gamification in that also. So you can do another machine kind of a curveball. And how, in case they are not losing weight, that's when they do have to get charged or something of that sort. So that, of course, you have to trust what they're putting on the weighing machine and weighing scale. You will tell me that. So
This is one of the
yes,
motivators.
it's a difficult, tough question for me to answer. Someone more who knows economics and techno-economics, I guess, can answer that. Maybe Mithun.
The psychology of the patient, I should say.
So I will answer that. So I think India में patient को हर चीज की वसूली चाहिए. So if they have given that, then there is that, onus comes, because I've spent so much money. I spent 40,000 on a program. I might as well stick to this program. They would be better sticking to the program. They'll give it more enough effort than they would not. So definitely that makes a difference in India. Free is not well respected. It's generally not. So, but I think when I was in UK, there was a system in obesity, because I had worked with Nick Feiner. Nick Feiner now, is my first job was with Nick Feiner. He now works for Novo, is the international boss. But at that time also they were motivational, because everything was free in NHS. So they used to give vouchers. If you achieve this, you will get this. You'll get free gym membership, or you'll get that. So you have to have that carrot. In life, you need that carrot for people to motivate. The stick doesn't really work mostly in life. The carrot always works. So on that note, back to Purvi, as we are closing time.
Yeah, this for the ring also, I'll just point out in one of the advertisement it is showing, if you are able to put 10,000 steps or lose this much amount of weight, 50% is off. So I think what Dr. Mithun said, the positive reinforcement works.
So I remember this story when I was a young person reading Chacha and Sabu. I don't know if you guys ever read those comic books, Chacha Chaudhary and Sabu. And there was a story, a fat man came to Chacha Chaudhary. He said, तुम रोज चल के आओ, मैं ये दवाई दूंगा. और रोज चल के आते आते उसको नमक की गोली देते रहता था. So I think that motivation factor, I just remember that, just out of the blue. But I think that motivation factor, that carrot, is a very, very important part.
Yeah.
Great. I think it's very interesting to see what motivates and what improves adherence with our patients, because we are all looking after patients with chronic ailments and lifestyle issues. So I think beyond technology, this psychology and understanding that really definitely helps. So great. I think I must thank all of you, Dr. Rucha, Dr. Anubha, Dr. Makkar sir, and Dr. Mithun, for joining us today and sharing your valuable time and sharing information with all our viewers. I think DTech Dialogues is really it's our intention to bring about high quality programs which are practical and yet very important as well. So I hope you enjoyed today's session as much as I did. And I thank the faculty experts again for joining in. Despite all the multiple commitments, it's not easy on a Friday evening. And I also thank USV and the tech support that they have given us. Excellent. Thank you so much. Dr. Rakesh Parekh in particular for, guiding us through the tech issues that we've had. And if the tech team can show the QR codes, please
It is on, Purvi. QR code is on. Yeah.
So do scan these. You can join the DTech WhatsApp group, or you can follow the DTech WhatsApp channel as well for more updates. I already told you all the carrots for the DTech Con registration. But I think if you are somebody in technology, in healthcare and diabetes, then you will definitely love to be a part of this community as such. And we promise to bring you yet another interesting session, probably in the latter part of this month. We will also be getting you some updates from ATTD, which is this month as well. So do watch out for more, and have a wonderful evening. Have a wonderful International Women's Day. And to all the healthcare providers and all people with diabetes or obesity watching this also, I hope that we all can take up a pledge to do something in the direction of healthful living. So thank you very much.
So thank you, Puri, once again on behalf of.
Thank you so much, Purvi.
Thank
Thanks,
you.
everyone. Bye
Bye.
bye. Have a good evening. Bye bye.
Bye bye.